I am here in the south of London with a very, very important personality too. I am here with our doctor, Dr. Victor Okuntolu, and he's going to tell us his specialty. But you know something very important. You know all those food we love in Nigeria, those inyoeba and everything with carbohydrates. I want to know what it does to people. Today we're talking about impotence in men. We're talking about diabetes. We want to know how we can work together to address those issues. We want to know how we can manage it as well. And then those who have men who are going through impotence, either the permanent one or just temporary one, we want to know the difference, we want to know what we could do. And then what about patients with ED, erectile dysfunction? We want to know the patterns of controlling that. So welcome, Dr. Victor Okuntolu.
Thank you for having me.
I appreciate you being here. It's not been easy to track you down. And could you tell us more about who you are and the area of your specialty exactly?
Yeah, thank you. My name is Dr. Okuntolu, as you've introduced me. Thank you very much for that.
Thank you.
I'm a consultant in endocrinology and diabetes.
Okay.
And I
within that field especially?
Yeah, my field is endocrinology and diabetes, and also do general medicine, of course, as every doctor does in this country. I trained at King's College, London, where I did all my specialty, and after that I finished in 2010. I've been a consultant since then.
Excellent. And you talk so fast. Have you had a patient say, "Excuse me, doctor," if I was a patient, they say, "Doctor, can you please write it small, small?" Say it again, you are too fast though.
Most often they say I'm too loud rather than
Are you loud?
fast, so I try to keep it down today.
And then you can't handle it.
Exactly.
You know, we love pounded yam, we love eba, and we say all that stuff, it's not bad. But what does that do to the body? How does that affect people with diabetes?
Normally, food is very important in everything we do in life. Although food is a very good source of energy, but it also can be a source of problem. So everything we do has got to be in moderate. It's not the food we eat, it's the amount of the food that is a problem. So obviously you ask me what does food does to the body. So if you take food in moderation, that everything is with the one we call the balanced diet, meaning protein, carbohydrate, and vegetable. If you give them a balanced diet, that's good for the body. But if you eat in excess, this excess food has to go somewhere. Obviously, when you eat too much of it, they have to be stored as a form of energy, fat, and the area where we store them as a fat is all our abdomen, the buttock area, and that's why people become obese.
That's where they get as fat as I am now.
Well, not particularly, but in Nigeria, obviously, or in developing country, when you are lean or thin, it's not being associated
with food. I don't eat much. I don't eat big portion, but I just do pick. So I think sometimes it depends on what made them big. It's not really the food, like you said. I believe that.
If you eat in a large quantity as a sitting, or if you eat, as you say, you pick as you go along, then obviously you will not be able to regulate the amount you eat.
That's true. Yeah, that's it. Yeah. Okay, you're just trying to you're economizing there, that's all right. Doctor, you've had people who have diabetes and hypertension. They mentioned that they do take some tablets to regulate it, to manage it. I want to know, so some of them did say that it not just reduces the libido, some men now are impotent, and they blame the tablets. What are these tablets? What can they do?
Okay, before I talk about the tablet, obviously we need to talk about what does impotency mean, because it can mean something different to different people.
Yeah, before we get to impotence, I wanted to quickly talk about the tablets for people who have diabetes and hypertension first, and then we delve into that.
Okay, that's fine. Yeah, so you're absolutely right. There are some medication that can reduce the libido and also causes impotency, meaning sort of reduce the sexual desire and also the lack of arousal.
They don't want it anymore.
Yeah.
They don't feel like.
So some of those tablets, well, the one that is so commonly used for high blood pressure is the one we call water tablet, and there's another one called beta blocker. These are the two most commonly prescribed for blood pressure, especially in Western world and also in a non-Western area. So especially the beta blocker is one that is often blamed as reducing the libido.
If they refuse, if they reject those tablets, are you with me? Because they want to feel numb, they want to feel active, they want to be active. If they stop using it, what happens to them?
Well, they don't have to use it because there's so many medications that can be used.
Oh, please
for
tell them.
management of
Please tell the
hypertension.
patients.
Yeah, there's so many medications that can be used, but obviously depending on which area you are. Some of these medications are cheaper. In Africa, I think we prescribe a lot of diuretic, the one we call the thiazide diuretic, which is cheap and easily accessible. But it's one of the ones that is commonly linked to reduction of libido and erectile dysfunction. The other one is a tablet called atenolol, which often in Nigeria and in Africa, they are combined with other medication which people might not know about. So obviously, if you're using any of this medication and you realize that it's affecting your erection and your libido, talk to your doctor and change something.
So talk to your doctor first. If you feel the doctor has prescribed a tablet to you or a new tablet, and when you get in behind the closed doors, you're not able to be a happy person like you used to be, I think the best thing for you to do, don't lose hope like the doctor said. There are other substitutes. So there are other tablets you could take, but don't do self-medication. No, don't.
Absolutely, yeah.
See your doctor, and then your doctor will tell you what to do. Before we go for a break, let's just quickly say something. What exactly leads to impotency? What is impotency? And what can they do to get it back up? So we're going to go for a break, and when we come back, we'll talk about that. Welcome back. Before the break, we did say that we're going to talk about impotency. We want to know what leads to it. And then we want to know when a man says he's impotent because he's maybe he had some tablets or anything happened, anything could lead to it. But what leads to it and what can you do to make it better?
Okay, before we talk about impotency, I'll just sort of explain what it means basically.
Yes.
A normal person, to sustain an erection, you need a complex physiological mechanism whereby the blood vessel work with the nervous system to allow the penis to be stiff and erect to allow sexual intercourse and normal penetration.
That's the normal erection.
Exactly.
And then when that doesn't happen?
When the inability to sustain a normal erection that is required for penetration is called impotency. Impotency means when the person is not able to sustain adequate erection for sexual intercourse. That is what impotency means.
Yeah.
However, we need to know that impotency does not mean complete lack of erection, because there are different classifications of impotency.
Okay.
There's mild, there's moderate, and there's complete failure of erection.
Excellent. And then this impotency we're talking about, at a stage, the man could get revived, if you get my point. The man could get, it doesn't mean it's irreparable. Is irreparable okay for this kind of a thing? It can repair?
No, it's not. It's one thing people must know that I need to let them understand is that impotency is not a disease. It is a symptoms sometimes of a disease. So therefore, if you treat the underlying problem, you get your erection back. So that's one thing.
For instance, someone who had stroke before is now better, erection comes back.
That's
because
possible.
The erection, because that's what, for instance,
Absolutely.
For someone who had stroke before and lost an erection, it's due to that illness. So what you're saying now is that it's a symptom to an illness. Oh, so something might have led to it.
Yes, in most
You're a very
cases.
good teacher, didn't you? I believe so. Thank you very much for watching Tinu Show. Same time, same channel. I sign out with smiles. Bye-bye.